Hi, this is Daniel Lenihan from Washington University in St. Louis, and I'm here to have a conversation with Bonnie Key, who's editor-in-chief for JACC Cardio-Oncology, and she's going to explain her vision and how we're going to move forward in cardio-oncology in the next few years. So Bonnie, what do you think about that?
Thanks so much, Dan. I think fundamentally we need to absolutely be focused on advancing science so that we can improve the clinical care of our patients. And in order to do so, I think we need to focus on three realms: research, clinical care, and education. And within each of these realms, I think we need to ask ourselves, what are our goals and what are our strategies for accomplishing our goals? For example, in research, I think one major priority is deep phenotyping, to really understand who is at risk, why are they at risk, and really use, I think, a multi-omics approach to better understand that. We really also need to better understand the cardiotoxicities of various cancer therapies, both conventional and newer therapies, especially immunotherapy. We know there's an explosion, and more therapies are being used in combination. And many other things, priorities and strategies in order to accomplish those goals in research, including the use of and leveraging EMR. All of us, as clinicians, we spend so much time on the computer, and we really need to learn how to use EMR, just both to understand the epidemiology of disease, but also to change physician and patient behavior. I think from a clinical care perspective, and I know you have a ton of experience here, and you've also written a lot about starting clinical cardio-oncology programs, we really need to provide a roadmap, for our clinicians and for the various sites globally in order to improve practice. And we need guidelines, better expert consensus, and better evidence to inform those guidelines. And then certainly from an education perspective, I know you're also leading a lot of efforts there in terms of certifying or potentially certifying fellows as well as physicians. And certainly I believe there too, we also need a roadmap in order to how to best educate people and best disseminate knowledge. And and I know you also feel this way, that we hope that JACC Cardio-Oncology will really serve as that knowledge base, that essential scientific resource, which will really accelerate the pace of discovery and clinical care for our field.
No, I think even the first issue, as uncertain as we may have been about the first issue, I would say that was a tremendous success. And I think that the scientific integrity of the first issue was astounding, and I think that we expect all the subsequent issues are going to be equally that good. And I think that we've been very excited by the types of submissions that we've gotten. So I think we see the future as very bright. I think it is bright, but we need to figure out how we're going to point the light so that we walk on the right path. That's probably what we need to do. Focus on how do we shine the light in the right direction.
Absolutely.